here today to be part of a conversation, to join carers, clinicians, allied healthcare professionals and other musicians to see what the future might look like for dementia care and how music might be able to support a better model of care. The idea was to bring people together, and in 3 different roundtables I wanted a conversation that was held both in a musical cultural institution like the National Concert Hall, in a healthcare setting like St James's Hospital and Mises Centre for Creative Life, and indeed out in the community. Here we are in Kells Courthouse. So it was important for me not just to have voices from different sectors, but also for these conversations not just to take place behind closed doors, but to be out into the community and into the sectors where this conversation will have relevance.
Today the conversation aims to achieve mapping and identification of opportunities as to how we could promote musicians in acute healthcare settings with a view to facilitate their involvement in patient-centered activities, but also about educating healthcare professionals about their benefit.
A key part of this work will be us producing a report which will allow us to further engagement with policy stakeholders to try and begin to start a conversation around how we might scale up this work and become embedded in care practice in nursing homes and communities across the country. And really we're talking about people with dementia and the family carers having access to musical interventions and musical engagement and encounters as part of their care plan.
Oftentimes when we think of dementia, we think of a narrative of tragedy. But when you see people engaged with music, you see the sheer enjoyment, the pleasure that they get, the well-being, the improvement in their physical movement and in their interactions, all from music. You can see the power that music can bring to people's brain health, and you see how impactful it can be in terms of improving their quality of life and their well-being.
I'm here today because I'm a full-time carer for my husband John, who was diagnosed with a dementia about 12 years ago. The core of today for me was, again, reinstating the relevance and the importance of music and the arts in the whole journey that the people are on.
Each roundtable has taken a format of where we have different input from different speakers, and then we break out to little roundtable discussions so that we hear other people's voices, and then we have some note takers that are gathering the conversations that were shared, and also a graphic illustrator. So it's important for me that this conversation lives on beyond the publication, beyond the journal, but really this conversation belongs to the community and to the voices and the people that shared all the information with us.
We've seen the value of how it impacts on our residents, on our staff, on the ethos and the environment and how we do our business every single day. It's fascinating to hear it from so many different angles and to get, I suppose, a concept of the challenges and the struggles that are there and very real.
I think the big thing that came out of today for me is the lack of funding in the area, particularly with the musicians that are going into nursing homes and the power and the joy they bring to the people there.
And I've learned so much from the different people contributing this morning. It's way above my expectation, to be honest. I'm really buzzing after it. And it's a real brainstorming session as well, which makes it all the more interesting because we're bouncing ideas off each other, the ideas are being noted and they're being shared. So I can see something very positive coming out of this whole experience today.
I think it's been a phenomenal few days of engagement, and there's been a real sense of hope, a real sense of anticipation and excitement, and there's a real opportunity there to make a difference. And the next challenge will be to make sure that, I suppose, we pull everything together and that we are consistent in terms of our advocacy approach and really making inroads in terms of policy and practice issues.
It's all about cross-pollination, you know, different fields, different people, different knowledge bases coming together to explore the topic. One informs the other, and I think having open conversations is a must to make the whole field of music and healthcare a more ubiquitous thing.